My name is Kim Shanahan and I am a pediatric physical therapist. A lot of times when people think about physical therapists, we think about pain and treating orthopedic impairments. However, in pediatrics, we focus a lot more on gaining mobility and function and restoring that to improve quality of life, to improve mobility, to address issues within a family. We work and go along with the family for a family approach, and we are really trying to make the child independent in school, home, and the community. Some common diagnoses that we treat, it's really quite a range. We treat cerebral palsy, spina bifida, genetic and neurologic conditions such as Williams syndrome, Turner's syndrome. We also treat kids who are just low tone, so hypotonic, high tone, hypertonic. We treat general developmental delay. We treat torticollis. We treat clumsy kids, so balance and coordination disorders. And we do also treat the pain and orthopedic children as well. Physician's assistants can look for several signs to refer to physical therapy in pediatrics. Some of the signs that you may look for would be developmental delay. Is a child hitting their gross motor milestones? Are they sitting? Are they rolling, crawling, walking, jumping? Are they able to balance and stand on one leg? All of those things parents may be concerned about. Some of their older children may have hit these signs earlier or they're unsure, so we need to make sure that we're asking them, is your child hitting these gross motor milestones when they should be? Also, we want to take a look at the infants when they're coming in. We want to look at their positioning. Is their head out of alignment? And then we want to address that. We also take a look at the gait pattern of the child. Are they walking on their toes? Are their toes turning in or out? Are they tripping and falling throughout the office? These are some of the things that we may not see or a parent may not report, but when you ask the questions and probe the parent, they'll tell you a little bit more about them. The earlier that you refer the child, the better in any case scenario, whether it be if they are slightly delayed in hitting their milestones, if they are toe walking maybe 75% of the time, not all of the time. If they're tripping and just clumsy on the playground, the earlier you refer, the better, because then we can address these things when they're younger, when they're developing their motor pathways, and we can develop them and address them at the younger age versus when they are 10, 12, into the teenage years. It's a lot harder to try to correct those already developed motor patterns. And the sooner that we address these things, the better. The sooner the kids can hit their motor milestones. For example, if you have a baby who's not rolling at the age that they should be rolling, around 7 months, but we don't receive the referral until they're not walking, then it takes us a lot longer to catch up on those gross motor milestones. So the first motor milestone that they don't hit, refer them then, and we can help them catch up as they go along. Even if you're unsure, absolutely, please refer the child to physical therapy. We have standardized evaluations and assessments that we go through, and they score the child based on their age in comparison to peers of the same age. So we can see where they fall, and if they fall even at the lower end of average, usually there's another factor in there, whether it be core strength or coordination, that we can usually justify the need for physical therapy if it is a concern for the family. If a physician's assistant is referring to another discipline or occupational therapy, speech therapy, for a child who just seems globally delayed, include physical therapy in that. If the physician's assistant is referring the child for occupational therapy due to poor postural control, poor motor planning, inability to grade their movement or grade the speed that they go, please refer to physical therapy as well. We can address those things, and it's great to take a multidisciplinary approach. The more people that address it and kind of embrace the issue from multiple aspects, the better. The stronger the child becomes, the quicker that we can address those issues that are present. Some things that may be overlooked by primary care practitioners are toe walking, in-toeing, and out-toeing. Frequently, primary care providers will say, the child will outgrow it, don't worry about it, come back in a year, we'll check again. Don't worry about it, come back in a year, we'll check again. By then the child is 10 years old and they are up on their toes and their calf muscles, their gastroc and their soleus have contracted to a point where they can't even get to neutral at their ankles and they are up on their toes. So again, early referral is key here. The earlier that you send them in, the better. That is one area that I think is really overlooked, as well as in towing. Sometimes it is a structural alignment and just bony positioning. However, if they are coming in with their toes in, that typically means they're tripping, they're falling, they're having these other issues. So we can work on hip strengthening, we can work on postural control, and we can help address these issues from other angles. So even if it is a structural alignment issue, we avoid the falls and the trips and constant bruises all over their legs. We work with DME or durable medical equipment suppliers to provide various medical equipment to children and families. The important part about this is that it helps improve the quality of life for the children and for the parents. It makes it easier on the parents to transfer the children, to know that they're in a supportive position, that they're comfortable in their wheelchair, that they're comfortable in the home in an activity chair, that they can stand and be at the same level as their siblings or their peers or different members within their family, and they can feel like they're really engaging in the situation and making the parent feel happy with the positioning of their child.